Hi, my name's Chelsea Newman, and I'm going to be going over coronary heart disease, also known as CHD. CHD is when plaque builds up in the coronary arteries, causing something called atherosclerosis. As the plaque builds, it causes a narrowing of the coronary arteries. Imagine a regular sipping straw becoming the size of a coffee stir straw. As this process happens, it decreases the ability of oxygenated blood to flow to the heart muscle, causing things like angina pectoris or heart attack. Having a weakened or damaged heart can lead to having CHD. Things that can cause weakening or damaging of the heart include smoking, high fat and high cholesterol diets, hypertension, and diabetes. There are several signs and symptoms that you could look out for leading to CHD. Those include angina, which is a chest pain right under the sternal area that is caused by a decrease of oxygen to the heart muscle. Angina pain can also radiate to the left shoulder and arm. The radiation is due to pain nerve fibers from the left shoulder and arm, as well as the heart muscle being stemmed from the same spinal cord segment. Other signs and symptoms to look out for are heart palpitations or heart fluttering. There is not one definitive test that leads to a diagnosis of CHD. Doctors normally order several tests to help come to a diagnosis of coronary heart disease. These tests can include EKGs, stress tests, heart ultrasounds, and blood tests. If those tests point towards CHD, a doctor can order a cardiac angiography or heart catheterization. In this process, dye is inserted through a catheter into the heart so that the doctor can see blood flow and recognize if the blood flow is constricted through those coronary arteries. Once a diagnosis of CHD is decided upon, there are several options. The first one is the most important, which is lifestyle change. This includes changing your diet, decreasing stress, and quitting smoking and drinking. There are medications that can assist from stopping CHD from progressing, but these medications are targeted more towards solving the disease processes that led towards CHD. For example, taking insulin for your diabetes or taking medications to help decrease your high HDL cholesterol, which is your bad cholesterol. There are also medications that can assist with attacks of CHD. Like we talked about earlier, angina pectoris is a sudden attack of pain that can become prolonged. For an acute attack of angina, medicines like nitroglycerin, which is a nitrate class medicine, can be used. These medicines help widen the blood vessels to allow more blood flow that is carrying oxygen to get to the heart muscle to decrease the damage. For long-term management of angina pectoris, you use medicines like beta blockers. Beta blockers allow the heart to use less oxygen demand when under stress, allowing the heart to not have sudden attacks of pain from angina pectoris. Ultimately, the management of CHD comes down to the patient. They need to manage their lifestyle and their environment. There are some genetic propensities to having CHD, including diabetes, high cholesterol, and other disease processes that can weaken or damage the heart. But all in all, to decrease chances of CHD, it relies on the patient. Thank you.